We'll give it a few more minutes and then we'll start. I see people are still joining. I'm going to go ahead and get started. If people, continue to join, if they need the back information, we will record these so they can always get the full details if they want it. I appreciate those that were able to join. I know this is challenging times for everyone. I'm hoping that today we can provide some information that might be able to help you as you continue to navigate these challenging times. Let me see if I can advance these slides. Rebecca, okay, here we are. Oh, too fast. We wanted to start off, actually, Katie, are you on?
Yes, I am.
Okay, great. Thank you, Katie.
Of course.
We wanted to start off at the top. Katie Cook was able to join us this morning, and she is our telehealth subject matter expert. So I wanted to give people a chance to see how they're doing with their telehealth, if they need any assistance. As you can see from the slides, just a couple questions I had posed. Are you using it? How's it going? And do you need help? We did receive one question already. The question is, are insurances paying for all codes?
That's a really broad question. So I'll try to answer this a couple of different ways, both from the Medicaid perspective and the Medicare perspective. From the Medicare perspective, if you go to the website that is linked on this slide, we have a host of resources that we've compiled on that site, one of which is a PDF document from CMS. Well, it's actually from the American Medical Association. 1 page is long, and it's all the CPT codes that are currently covered by telehealth for Medicare. So it's quite an extensive list, and CMS has gone on record that during the public health emergency, basically any services that you can provide virtually can be reimbursed through telehealth. Again, I'll refer you to our website for that list, and I'll share this document with Luann and Rebecca after the fact so that she can send it out with any meeting notes after. So from a Medicare perspective, yes. Medicaid, our state Medicaid has essentially said the same thing. You know, effective for dates of service on or after March 1st for the duration of the public health emergency, the governor's executive order 202 was that New York State Medicaid will essentially reimburse telephonic assessment monitoring and E&M services provided to members if they can't be there in person. And they're really encouraging telehealth at the state level. So I have not seen any one particular service not be covered yet. Pretty much all payers are saying, you know, whatever you can provide virtually, we will reimburse. Private payers, their information's a little tougher to find. But what I've been seeing is that whether it's COVID-19 related or not, services provided virtually will be reimbursed during the public health emergency. And I've also been seeing that payers, both state, federal, and private, not all, are even putting out statements that they will cover at the same rate as an in-person visit. As you all probably recall, we have coverage parity in New York State, but we don't have reimbursement parity. So right now there seems to be a lot of reimbursement parity happening, which is really so. In a long-winded way, to answer that question, you know, it is a broad question, but the answer is yes. Everything is pretty much covered virtually right now.
The second question was, do we waive all copays for telehealth, even if not COVID?
That is entirely up to the provider. So the Office of Civil Rights has stated that or HHS, Office of Civil Rights, has stated that cost sharing can be waived by providers with no penalties or audit in the future. So that's entirely up to the practice and the provider if they want to waive the cost sharing, whether it's COVID-19 related or not.
Thank you, Katie.
You're welcome.
Are there any other questions, or are people needing to know where they can get resources?
Something I'll also mention, Luann, and I know some people on the line are waiting to hear from me specifically in regards to some AHI funding. I am hoping to have those answers later today. But in the interim, there has been some released funding through several resources, and I'm going to just go over those really quickly with all of you. So the Federal Communications Commission has released a COVID-19 telehealth program as part of the CARES Act that was signed into law, I believe, on the 27th of March. So this program has $200 million in funding appropriated by Congress. Eligible healthcare providers can apply. If anybody's interested in that specific link, please reach out to me. I can send that to you. There's also
You broke up, Katie.
process. There are some little nuances you'll need to take care of when you go to apply for that funding. That funding is on a rolling basis. There's no deadline. The deadline's basically when they run out of money, and I have not heard that they've run out of money yet. Second to that, the Novartis U.S. Foundation has $5 million established to support local initiatives in communities impacted by the outbreak. New York is one of the states that providers can apply for funding under Novartis. The funding is for a 1-year period, and applicants need to be verified 501c3 organizations. So I can send a link out to that as well if you're interested. The New York State Health Foundation has also contributed $2 million to regional response funds. If you go to their website, they have a list of different resources that you can look into, possibly apply for, find out if you're eligible, things like that. So I know that everyone on the line, I am seeing who's on here, and I applaud you wholeheartedly for standing up telehealth programs in such a rapid manner. So kudos to all of you on the line for working so hard to make that a reality. Something that I'm hearing a lot of and have stated myself on several calls is that while you've been able to implement telehealth very quickly, and I don't know the ins and outs of all of your programs, something I cannot stress enough is if it's possible, start thinking long-term, because the regulatory flexibilities that we've all been granted through the telehealth space right now, I can't imagine that all of them are going to stick when the state emergency, the public health emergency is over. Do I hope that a lot of these regulatory flexibilities will continue, because we've obviously seen a benefit to providing telehealth during this time? I'm optimistic, and I think some of it will. But we want to plan for things going back to the way they were before. And I would hate to see all of you work so hard to implement virtual services, and then when the regulatory environment kind of stabilizes, you're no longer able to provide that service. So if that's something you want to talk with me about, we can have a separate conversation in planning for the future and what you need to do to ensure sustainability of your program.
That's a great suggestion, Katie, because I would agree with you. We're hearing too from the Department of Health, et cetera, that many of these waivers that have been granted are being looked at for long-term implementation, and how people might be able to move forward with a lot less of these regulatory requirements around some of the, more stringent areas that we recognize. There's a lot of waivers that have been put forth that are very helpful. And I think, telehealth is definitely at the top of the list.
Absolutely. And something that Fort Drum, who is our partner in the North Country Telehealth Partnership, and I did 2 calls about 2 weeks ago, and something that they brought up, because they're very much focused on the technical assistance and the technology component. And I'm sure as many of you read, the Department of Health and Human Services has put out some relaxed HIPAA regulations as it relates to telehealth, and gone so far as to say that if needed right now, you can utilize smartphone applications such as FaceTime, Facebook Messenger chat, Google Hangout, consumer-facing Skype. And, I applaud that, and I see where they're really just trying to create access. But both Tom Zetcher, who's the CTO at Fort Drum Regional Health, and I stressed that if you need to use that, for a one-off visit because the patient just doesn't quite, technology all that well, that's okay for right now. But I would not consider implementing a telehealth program based on FaceTime. You're putting yourself and you're putting the patient at risk. And while HHS is not going to audit or impose any penalties on your practice, just again, long-term, we want to stay away from those consumer-facing apps. I know that OASAS and I believe OMH are stating that they still want practices. Now these are Article 31 and 32 clinics, which is not really representative of this group, but they're saying, no, we don't want you using those. I know HHS said it's okay, but we want you to comply with HIPAA and 42 CFR Part 2. So if you've implemented a program mostly based on using those apps, we've created, Nancy Del Mastro has created a telehealth vendor resource guide that is full of HIPAA compliant solutions. And that's on our website, again, for you to access. And we're always available for questions.
Great. Thank you, Katie. And that's a good point about the FaceTime. I know that's been an option for an immediate response, but I would agree we have to be cautious about the privacy for our patients.
Right.
Any other questions from anybody based on anything you've been trying to do with telehealth or anything Katie has recently said or stated here? Okay, we will go on to the next slide.
Thanks for having me on, Luann.
Oh, you're welcome, Katie. Thank you for joining us. I appreciate it. A couple of NCQA Updates. There is a response page on their website, and here is the link as well. I think the biggest thing, and we did attach a document to the meeting, and I think I sent it all as well, is people looking for their extensions. We've had several people. Oh, it advanced without me. Rebecca, is that you? Can you take it back? It's not letting me do that. Thank you. People applying for extensions. Again, they're basically saying there's no blanket extension. It really is on a case-by-case basis. But what we have seen so far is quite generous extensions for people given the current circumstances. We have been assisting people with actually going in and putting in those requests for extensions. And we've also provided the document that you see attached for those that will go into QPAS and manage some of these things themselves. We kind of gave a little step-by-step of how you can go about doing that. If you need any assistance, again, myself, you can email me. I know Janet's been also working with some people as well. So by all means, reach out to us if you have any questions, or, and Jessica as well, any questions or concerns about what you're trying to accomplish with your extensions. Again, I would stress they've been very generous, going well beyond that 2-month for several organizations already. Any questions or challenges people had with that? Okay. Couple other comments. They have indicated that they will show an increased flexibility during their virtual reviews. I did have an opportunity to sit through a review with one of our partners, and I will say that the reviewer was extremely generous, allowing a lot of explaining and talking about the process, because the individual wasn't inside the practice, so they didn't have access. And as well as, you know, they talked a little bit about reporting out on some of the metrics that right now everybody's metrics are being kind of thrown sideways with the COVID. So they are either recommending or on their site have suggested other ways to look back, if you will, and get some of that information. So I do believe if you're working with an individual reviewer, they have been quite generous. I think the next bullet point about showing evidence of processes anytime during the past year, again, it doesn't have to be something that's within the last 3 months, if you will, because we know the last 3 months is really kind of tainted with COVID, if you will. So they are allowing people to go back further. They also understand that some of the work you're doing is not currently active. The patient feedback, you can't really do that right now. Many of these processes that people have put in place require actually giving something to the patient. So that has been also recognized by the reviewers. The telehealth we already spoke about. Some of the criteria that might have impacted your practices, again, we just listed a few of those because you can't really manage some of these things right now, especially if you're not in the office. I do have one question I'm going to share with you. There was a concern that an individual is planning on implementing some items for their renewal, and they're transitioning to annual reporting. The example they gave was the CAGE age screening and the risk stratification. Again, what we are hearing from NCQA is that they are recognizing that processes might not be able to be implemented, so they are making exceptions as well. I will stress with people, if you are up for annual reporting, you may want to consider asking for an extension if you're right in the middle of or have had to postpone any implementations. We can certainly work with you individually to help you get there, but you know, at this point in time, I think NCQA has recognized many of your processes are not in place. Jessica or Janet, do you have anything to add to that particular question?
Yeah, no, Louie, I think you hit it right on the head. Really, if there are things that you have been doing consistently but are now on hold because of COVID, you are able to show proof that everything was in place prior to this very unprecedented time. So my recommendation is to try to get documentation and evidence in case you were to be audited to show that you have these processes in place before you transition to telehealth and this new world that we're living in for an undetermined amount of time. If there is something that is a new process that you have not been able to implement solely because as you're approaching that implementation date, we were struck with the COVID pandemic and things changed and it no longer was feasible to implement, then I would absolutely reach out to NCQA or reach out to us and we can help you facilitate that conversation with NCQA to say, you know what, we really need an extension. And right now what I'm seeing is generally the NCQA representatives are able to give a blanket 2-month extension when you go in and you personally ask for that request. Anything longer than that, I think is going to be more of a conversation, but I would assume that if we get to that 2-month point and we are still impacted by this pandemic, that they are going to be generous again and continue those extensions, because there are just certain things that might not be conducive to a telehealth environment, may not be conducive to an environment where staff are furloughed or you're working with a less than optimal team at this moment. So if you are struggling and you want to have a conversation about, you know, can we implement this if we're doing telehealth, or should we really just keep pushing for these extensions and document a plan to get it up and running when we're back in the office? I'm happy to have those conversations. I'm sure Luann and Janet are happy to have those conversations, and we are here just to help you facilitate this, to make sure that what you're doing is the most meaningful thing for you and for your patient population.
Thank you, Jessica. We got Janet did respond. Unfortunately, she's been booted off her video, so she is listening. But at this point in time, she had nothing else to add. I did get another question about, you know, the satisfaction survey, whether or not there was any telehealth questions on the satisfaction survey. If you're using a standardized one, to my knowledge, and I'll again defer to Janet and Jess in case they have any additional information, it is not currently on those questionnaires that I'm aware of. If you have your own or you're using something that's been customized and you have that luxury to be able to change it and get it out there, sure, I would certainly ask a question about the telehealth. If nothing else, it'd be great feedback. But I don't think it's necessarily something, you know, given all that you're trying to do, that be the top of your priorities. But again, if you had the time, I think it would be great to learn about some of the experiences from our patients. The second part of that, another question was, should we try to do risk stratification for our telehealth visits? Again, I don't know that anyone has in their risk stratification process anything about telehealth. Now, the flip of that, if I'm understanding the question, is you should be doing some risk stratification to maybe identify patients that are at potential risk and see if you can't reach out to them for a telehealth visit. I certainly would suggest that. But again, some people have indicated to me they can't really do the risk stratification if they're not in the office. And I do hear some offices are very limited with what resources are available, and even the hours that they're actually there and opened. But yes, if there is a way to, do some risk stratification on your patient population within your own EMR, I would certainly recommend it just to see if there are individuals there that might need some outreach. And I know many of you are already doing that, as I've heard from some, that they have been able to pull out of their EMRs based on some criteria in their own risk stratification processes, those patients that are at risk. Anyone else with any questions about NCQA, processes they are or aren't trying? Okay, I'm going to go ahead and move on.
Luann, this is Katie. I don't know if it would be beneficial or if it would just create more work, but there are telehealth patient satisfaction surveys that have already been created by other networks.
Oh,
I could share a few examples with you for the meeting notes if that would be helpful for anyone.
absolutely. I think the more information we can provide them with, and again, like I said, if they have the time, they can certainly do that. But that would be great that they don't have to create anything themselves. It's always better to share.
Okay, I'll send you a few.
Thank you, Katie. That's great.
Yep.
And Luann, I just wanted to add for everybody that telehealth is considered an alternate appointment type, and that would satisfy the criteria for AC06, which would give your practice 1 elective credit. So if you have implemented telehealth and you have a documented process around it, then you would be able to qualify for that elective credit.
Excellent point. Thank you, Jess. Anyone else? Comments, thoughts, questions? Okay. Rebecca, thank you. This is just a slide I had put together. There is a lot of information out there about small businesses, and these were a couple of the links that I found as of, time of publication for this particular slide deck, that around the paycheck protection piece, and I even applied or provided the link to the application form. There's also some small business, the owner's guide, and then as you know, the Lake Champlain, Lake George Regional Planning Board has had some information out and about. They've even had some live sessions that they've provided information for people. If you have any questions, I certainly would recommend looking into these sites and seeing what you can do to help your practices. As well, you can always contact AHI. We have some people in-house that are able to address some of these answers and help people process some of this information. It is so much information, and I know everyone's in overload, but to try to help out the smaller businesses would be certainly something we could assist with. Next slide. Oh. My additional resources didn't get there. Huh. Okay, well, that's a shame. I will make sure, evidently that page missed out getting there. A couple things. The website, the AHI website has a lot of information. We actually have a banner, and it's ahihealth.org, and we have a banner with a lot of the COVID stuff. One of the links there is to waivers, and what we're doing is actually on a daily basis updating any waivers that we learn about, get information about. We're getting flooded with information and sharing it amongst ourselves and with others. But we did come up with a spreadsheet. It can be a little intense, but what we've tried to do is at least give a brief description of what the waiver pertains to, and then a link to the actual waiver or site where it's located. So it's one way for people to be able to kind of scan through to say, do any of these really apply to me? And there are waivers of all types. Every, state health department or the DOH, OASS, OMH, we have a lot of the websites up there, including some of the small business stuff as well, and telehealth. In that COVID banner as well is a direct link to the telehealth site, as Katie talked to earlier, and the link was on this slide. I'll fix these slides and send out those links for you on this page so that you can have those directly within your PowerPoint. The other piece, and I think everybody should be getting it now, is on Monday, Wednesdays, and Fridays, we are sending out a newsletter, a COVID newsletter that tries to give the most up-to-date information from the previous day's emails, etc. If you aren't getting it, again, contact us and we can make sure you will get that. But I did have them cross-check all the mailing lists and you should be on it. As well, I know, and I don't know if Brenda's still on, but the ACO was also producing, I believe on a weekly basis, a newsletter that has also got a ton of information that's helpful. I know with all the information overload, what we're trying to do is provide just a snippet of what it's about and then give you a link so that you can determine, do I need to see anything more? Because some of these pieces come with pages and pages of information, and again, who has that time? So those are kind of like some high-level resources I know that are available. Brenda, did you have anything to add about the ACO newsletter?
So the ACO newsletter should be going out next week. It's, you know, I think everybody, because of all the information that is out there, is trying to streamline some of the information into something that is certainly helpful for the providers. So I know that it should be going out early next week. You know, I think the feedback that you're able to provide to us of the areas or things that are really creating barriers for the care that you are trying to provide, if you are able, you know, to get that information to us so that we can look into that and really address that, especially around the payers are concerned. You know, Katie did a good job earlier describing certainly the discrepancies that are out there. It would be great in a time like this that they could just follow CMS and you know, their rules and regs that went out around telehealth to really streamline our processes. And I have to say that many payers have stepped up to the plate, you know, regarding reimbursement as if they were face-to-face visits. So, you know, the other thing that I stress, and I think, you know, it'd be great if we could all be the, you know, be able to provide you the information down to the payer, but because of the different contracts that are out there and individual contracts that providers have, you have your payer rep who can certainly direct you to what is specifically being reimbursed by a specific payer, and they're a great resource. So don't forget them right now. I know that there's a lot of great reps that are, you know, from the different payers that are there that can really help bring you up to speed and make sure that you are billing correctly. I think that payers have also built in the background the ability to bill, whether you bill and it's correctly billed as a place of service. I know there are a couple out there that if the wrong place of service is attached to a telehealth visit, they will automatically change that to a place of service 11 so that you can get reimbursed as if it were a face-to-face. So, you know, I think everybody right now is in a trying to transition very quickly with all the changes that are happening on a regular basis. So, you know, I really commend everybody that's on the call and the changes that have been made very rapidly. And I know it's already been said, but, you know, there's a lot of information out there, and I know it's like you're at the end of a fire hose right now trying to just decipher which direction you need to go. So thanks, Luann.
Thank you, Brenda. That really is about all we had for any kind of a formal presentation. I open it up right now if anybody has any questions or additional thoughts or information that they've discovered through this challenging time that they would like to share. Okay, again, you have, excuse me, both of our emails on here if you need anything. I will correct that one page that doesn't have those resources listed as far as the various newsletters as well as the links to the website. And otherwise, everybody can have their time back. If you need anything, we're all here. And in the meantime, please stay safe and stay well.
Thank you.
Thank you.
Thanks, Luann.
Yes, absolutely.